Hey, everyone, welcome back to the channel. It's Vlogmas Day 11, and today, I'm excited to bring you a video that's perfect for those looking to step up in their healthcare careers. We'll be covering NHS Senior Healthcare Support Worker interview questions and answers. If you're preparing for an interview in this role, this video will give you valuable insights into what to expect and how to answer confidently. Whether you're looking to move into a senior position or want to brush up on your interview skills, I've got you covered. Let's dive into it. 1. Why do you want to become a senior healthcare support worker in the NHS? I want to become a senior healthcare support worker in the NHS because I am passionate about providing high-quality, compassionate care to patients and making a positive impact on their lives. Over the years, I have gained valuable experience as a healthcare support worker, where I have developed strong clinical skills, the ability to manage complex situations, and a deep understanding of patient care. I feel ready to take on a senior role where I can not only further develop my skills, but also take on more responsibility, mentor and support junior staff, and contribute to improving patient outcomes. The opportunity to work in a dynamic, team-oriented environment like the NHS, which prioritizes patient care and professional development, excites me and aligns with my career goals of providing leadership in healthcare while continuing to learn and grow. 2. Can you describe your experience in providing care to patients with complex needs? In my previous roles, I have had the opportunity to care for patients with a range of complex needs, including those with chronic illnesses, mental health conditions, and physical disabilities. I ensure that I provide person-centered care by taking the time to understand each patient's individual needs, preferences, and goals. I work closely with the multidisciplinary team to develop and implement care plans, ensuring all aspects of the patient's condition are addressed. For example, I have worked with patients who have both physical disabilities and mental health challenges. In these cases, I supported the patient with daily activities, medication management, and ensuring they had access to emotional support. I also monitored their progress and communicated with the healthcare team to adjust care plans when necessary. I am comfortable using different techniques to manage complex care needs, such as assisting with mobility, providing personal care, and offering emotional reassurance. I ensure that I maintain patient dignity and respect, while also making sure that their medical, psychological, and social needs are met effectively. My experience in this area has allowed me to develop strong problem-solving skills, as well as the ability to remain patient and adaptable in dynamic care environments. 3. How do you handle pressure in a fast-paced environment? In a fast-paced environment, I handle pressure by staying calm, organized, and focused on the task at hand. I prioritize tasks based on urgency and patient needs, ensuring that critical care requirements are addressed first. I break down larger tasks into smaller, manageable steps to avoid feeling overwhelmed. Communication is key, so I regularly check in with colleagues to ensure everyone is on the same page and that we're working together efficiently. If necessary, I delegate tasks appropriately and ask for help when needed, ensuring that the quality of care remains consistent even during busy periods. Maintaining a positive mindset and being adaptable also helps me stay on top of things and provide the best care possible. 4. How do you ensure high standards of care are maintained in your role? In my role as a senior healthcare support worker, ensuring high standards of care is a top priority. I achieve this by strictly following care plans and NHS guidelines, ensuring that each patient receives the care they need based on their individual circumstances. I regularly communicate with the multidisciplinary team to discuss patient progress, share updates, and address any concerns. I also encourage patient feedback to ensure that care is meeting their expectations and needs. Additionally, I maintain a strong focus on health and safety protocols, ensuring that all practices are safe, effective, and in line with NHS standards. To continuously improve care, engage in reflective practice, seeking feedback from colleagues and participating in professional development opportunities to stay updated with best practices. By fostering a culture of teamwork, open communication, and continuous improvement, I ensure that the highest standards of care are always upheld. 5. How do you support and mentor junior healthcare support workers? In my role as a senior healthcare support worker, I believe that supporting and mentoring junior healthcare support workers is crucial to building a strong, effective team. I lead by example, demonstrating good practice in all aspects of care, from patient interactions to adhering to policies and protocols. I offer guidance and share my knowledge, helping junior staff understand their roles and responsibilities more clearly. I also encourage open communication, making sure they feel comfortable asking questions and seeking advice when needed. Additionally, I provide constructive feedback and help junior workers reflect on their performance, offering suggestions for improvement while also recognizing their strengths. I make sure they understand the importance of empathy and dignity in patient care, and emphasize the importance of teamwork in delivering the best possible care. I encourage their professional development by pointing them toward relevant training opportunities and supporting their learning goals. Through regular check-ins and a supportive approach, I ensure they have the confidence and skills to succeed in their roles. 6. Can you give an example of a time when you dealt with a difficult situation involving a patient or colleague? One example that comes to mind is when I worked with a patient who was experiencing a lot of anxiety and was becoming increasingly agitated during their treatment. They were refusing to take their medication and were very resistant to care. I remained calm and patient, using active listening to understand their concerns. I asked open-ended questions to let them express their feelings and validated their experience, which helped reduce some of their anxiety. Once they felt heard, I reassured them about the treatment plan and explained how the medication would help them feel better. I also involved the senior nurse to ensure that the patient felt supported by the entire team. By maintaining a compassionate and patient-centered approach, I was able to help de-escalate the situation, and the patient agreed to take their medication. This experience reinforced the importance of staying calm, empathetic, and communicating effectively in challenging situations. It also highlighted the value of teamwork in providing holistic care and supporting patients through difficult moments. 7. How do you ensure patient dignity and respect are maintained? Ensuring patient dignity and respect is central to my approach as a senior healthcare support worker. I always treat patients with kindness and empathy, listening carefully to their concerns and respecting their preferences. I make sure to maintain their privacy and confidentiality at all times, both in conversations and in the care I provide. This includes ensuring that patients are always addressed respectfully, using their preferred names and pronouns, and asking for consent before carrying out any personal care tasks. In addition, I involve patients in decisions about their care, providing them with information so they can make informed choices. I also ensure that their cultural, religious, and personal beliefs are taken into account in the care plan. Lastly, encourage open communication, creating an environment where patients feel comfortable expressing their needs and concerns, knowing that they are being heard and respected. 8. What would you do if you identified a safeguarding concern? If I identified a safeguarding concern, I would follow the established procedures to ensure the safety and well-being of the individual involved. My first step would be to report the concern immediately to my supervisor or the designated safeguarding lead, ensuring that I provide as much relevant information as possible. I would document the concern thoroughly, making sure to capture the facts without making assumptions or judgments. Depending on the situation, I would ensure the individual is protected from further harm, while maintaining confidentiality and respecting their dignity. I would then work closely with the multidisciplinary team, following any guidance from safeguarding professionals, and ensuring that the issue is addressed in line with the NHS safeguarding policies. Ultimately, the safety of the patient is the priority, and I would ensure the concern is handled in a timely and appropriate manner. 9. How do you manage and prioritize your workload when handling multiple patients with different needs? When managing and prioritizing my workload with multiple patients, I start by assessing the urgency and complexity of each patient's needs. I make sure to identify any critical care requirements first, such as patients who are at risk or in immediate distress. I then create a clear, organized plan for the day, breaking tasks down into manageable steps and setting realistic timeframes. I communicate with my team to ensure we are aligned on priorities, and if necessary, delegate tasks to other healthcare support workers or ask for assistance. I also remain flexible throughout the day, as patient needs can change, and being adaptable ensures that I can respond to any urgent situations. I regularly check in with patients to monitor their progress and adjust care plans if needed. By staying organized, focused, and in communication with my colleagues, I can effectively manage my workload and provide high-quality care to each patient. 10. How do you ensure effective communication with patients, their families, and the healthcare team? Effective communication is crucial in my role as a senior healthcare support worker, as it ensures that patients receive the best possible care and that their families and the healthcare team are fully informed. To communicate effectively with patients, I first ensure that I approach them with empathy, patience, and active listening. I always make sure to explain things clearly and in a way that is easy for them to understand, using simple language when needed. I also take time to address their concerns and preferences, ensuring they feel heard and respected. When communicating with patients' families, I maintain transparency by providing them with relevant updates, while also respecting patient confidentiality. I ensure that I listen to any concerns they may have and work to involve them in care decisions where appropriate. In terms of communication within the healthcare team, I make sure to keep clear and detailed records of patient care, which helps ensure continuity. I also engage in regular handovers and team meetings, where I share relevant information about patients' conditions and progress. I believe in being proactive and raising concerns or observations to ensure everyone is on the same page, and that we're all working together to provide the best care for the patient. Do you have any questions for us? Yes, I do have a few questions. I'd like to understand more about the team structure and how senior healthcare support workers collaborate with other healthcare professionals in the multidisciplinary team. How does the team ensure that communication is effective, especially when managing patients with complex or changing needs? Additionally, I'm interested in learning about the training and development opportunities available for staff in this role, particularly regarding progression and further qualifications. Finally, what are the main challenges someone in this position might face, and how does the team support each other in overcoming them? Thank you for the opportunity to ask these questions. That's all for today's video on NHS Senior Healthcare Support Worker Interview Questions and Answers. I hope you found the tips and strategies helpful as you prepare for your interviews. Remember, with the right preparation and mindset, you'll be ready to take on any question that comes your way. Don't forget to like, subscribe, and click the notification bell to stay updated with all the Vlogmas content. Thanks for watching, and good luck with your interviews. I'll see you in tomorrow's video.